So, Mr. Hafifi, I will pass this session to you. Okay, silakan. All right. Okay. Okay, I can see your PowerPoint.
Okay.
All right.
Thank you to Mr. Ramizan, our lovely moderator. Bismillahirrahmanirrahim. Assalamualaikum and very good morning. First of all, I would like to say thanks to Physiotherapy Department, Faculty of Health Science, UiTM, and also to the organizing committee for organizing this fabulous international webinar. And thank you for inviting me to share something related with spinal cord injury. So my name is Hafifi, currently working in Social Rehab Center, handling mostly people with SCI and other neurological patients such as stroke and brain injury. So today I would like to share some tips and tricks how to enhance the physical fitness among individuals with SCI. All right, so actually in Social Rehab Center, physical fitness among disabled people, including SCI, is the main goals because most of them are chronic patients and prepare for return to work. So before we start, let's go to the presentation outline. The presentation will consist of introduction to SCI, ICF disability framework, exercise recommendations, the intervention to increase the physical fitness, and then the evaluations and testimony, as well as the conclusions. So as introductions, spinal cord injury or SCI can be defined as the damage of spinal cord due to trauma, events or non-traumatic events. Okay, the traumatic events such as motor vehicle accidents, MVA, falls, sports and recreations, and as well as due to violence such as backstab from behind. And in addition, SCI also can occur due to non-traumatic events such as degenerative disease, infections or unknown causes. And the injury to the spinal cord may result in partial or total loss of motor movements or sensations such as warm, cold, sharp and blunt. And it's not just that, the SCI may cause dysregulation of autonomic body systems whereby the sympathetic and parasympathetic of the body such as circulations, urinations and body thermoregulations were interrupted. So now we go to the prevalence of SCIs. So according to WHO, SCI can occur from 40 to 80 cases per million people in the world, according to WHO 2013. And about 200,000 to 500,000 SCI can occur yearly. And in 2016, specifically, about 900 people had suffered from SCI. And from 1990 to 2016, about 27 million globally of people suffered from SCI. And from 2007, and from 27 million, about 9 million came from a high-income country, and then 5 million came from a middle-income country, and 13 million from lower-income country. So specifically in Malaysia, currently we have about 70,000 of people suffered from SCI. As compared to Indonesia, about 500,000, Thailand 150,000, Singapore about 39,000. Okay, so if we can see here these numbers, so that means we need proper rehabilitations or program so that we can prevent from the secondary the complication development, so to prevent the burden to the family and stakeholders. And so what are the impacts of SCI? So basically from international classification of functions, they classify first the SCI from the impairment. So what kind of impairment SCI may face? So if we look here, under the impairment, the SCI may have a low aerobic capacity, low muscle power, which leads to functional limitations, causing difficulty to walk, and also unable to perform activity of daily livings, hence unable to drive. And this kind of functional limitation may lead to the participation restriction, such as unable to go to work, which leads to unemployment, and also unable to join the sports family event. And because of the participation restriction, the patients have financial burdens, and also have isolation, hence will cause poor quality of life to them. And however, the disability levels can be modified. By the barriers and facilitator factors, by the environments like accessibility and personal factors, such as motivations and exercise self-efficacy. Okay. Why I cannot proceed? Okay. All right. So if we look here, previous study had found that found low physical activity among SCI individual with more than 50% of SCI not engaged with physical activity. So in Malaysia, there were about 73% of individual with SCI does not engage with physical activity, and the low physical activity may increase the risk of cardiovascular disease, diabetes mellitus, obesity, pressure sore, and low physical fitness. So the question is, when we can recommend physical activity to people with SCI. So basically, it depends on the goals of rehabilitations. If we look here in acute stage, 1 to 4 months, usually this stage is to aim for medical stability and also to prevent from complications such as pressure sore, autonomic dysregulations, and so on. And after that, after the acute phase over, so the patients start to go to subacute stage from 4 to 12 months. So this is stage where usually supervised by the healthcare practitioners such as physio and OTs. And this is a stage where we aim for rehabilitations and recovery and also for complication preventions. But after the rehabilitation finish, we discharge them to go to homes, and this is where chronic stage take place, mostly about more than 1 year. So this is a area where usually they are unsupervised to perform their exercises, but they need to self-manage the health conditions, including they need to do the self exercises to maintain quality of life and also to prevent from complications. So usually we can start recommend the physical activity at the end of the rehabilitations, so that they can bring the physical activity knowledge at home. Okay. And then if we look here, previous study from Emmons et al. 2008, it was found that the physical activity during the supervised period is increasing, but suddenly abrupt when they start to going home, and after that the physical activity start to increase because of many factors. So basically, more studies should be conducted why this thing happens, especially during unsupervised period. Why the physical activity is abruptly decline, start from after discharge from the rehabilitations, and then why suddenly the physical activity is increasing. This period is maybe because they already adapt with the environment and they're able to adjust themselves, so they start to active again. Okay, but mostly the complications occur during these periods after discharge, and then about 1 or 2 years they are very sedentary, and this is where usually the secondary complications occurs. So because of the low physical activity, it gives challenge to obtain the physical fitness among SCIs. Okay, that's why we need something, activity or exercise that can increase the adherence with each exercise and to continuously engage them with exercise, even though they are discharged from the rehabilitations. However, the physical fitness also is very challenging because they have kind of a situation of blunted heart rate, and due to the dysregulation of the sympathetic and parasympathetic systems, and because of the paralysis also, the diminishing of the absence of muscle contractions is very difficult for the muscles to contract and supply the blood to the cells, and also will compromise the venous return. So therefore we need sufficient exercise that can give sufficient stress to the cardiovascular system so that the blood can be sent to the whole body of the patients. So if we look here in Malaysia, the fitness program for able body, there are so many fitness programs for able body, including Zumba, HIIT, running events, sports event, Ironman, Diet Fit, Jom Kurus. But how about disabled people, specifically for SCI? There are a lot of them, about 70,000 of people with SCI, but I would say none of our community program tackle them. We conduct so many fun run, but how about the wheelchair users? Yes, still in question. So this is something, this is area that we need to develop. Okay, so so that they can participate and maintain their active lifestyle. So before we can recommend the exercise, we need to know the exercise recommendations. What are the evidences? And from for author Jacob Nash, WHO itself, Guinness et al., and also Tweedy et al. So most of them agree that they should perform strengthening exercise about minimally 2 times a week, targeting the major muscles. And most of them agree that they must perform 3 sets of exercises, 8 to 12 repetitions. And for Guinness, they recommend about 1 to 2 minutes rest between sets. However, for Tweedy et al., they recommend about 2 to 3 minute rest between sets. And they said that the exercises must be performed about 60 to 70% of 1 RM, 1 repeated measures. And just 4 to 5 exercise is just enough. Otherwise, it will take too long and will cause fatigue to them. And this is the exercise option for them, but you may choose about 4 to 5 exercises, usually with the aims of to prevent from muscle imbalance. Okay. So here, based on your assessment, you may choose which, such as chest press for pec major, vertical row for back, wide latissimus pull down for latissimus dorsi, external rotations for external rotators, tricep push or tricep, bicep curls for bicep, shoulder flexion for shoulder flexor, shoulder abduction and shoulder abductor. So this one you can use by closed or open chain method by using TheraBand, or dumbbells, or exercise machine with multi-gym exercise machines. But this is very difficult to find the exercise machine for wheelchair user. But if you can find that in your clinical setting, yeah, it's very good. Okay. Otherwise, you may use a TheraBand or dumbbell, something like that. So we can conclude that the prescriptions, just 4 to 5 exercises just enough. 3 sets, 8 to 12 repetitions, moderate to high intensity, 60 to 70% for 1 RM, 2 times a week, 1 to 2 minute rest between sets. And one most important thing, in order to gain the physical fitness, you must progress the weight. All right, don't let your patients maintain at the same intensity from week to week. So you must progress. Okay, so the intensity must be progressed weekly if the participants can complete the sets without any signs of tremor or compensatory movements. Okay, so how about the aerobic exercises? For aerobic exercises, from all 4 authors or scholars, there are many variability of the recommendations, such as by Jacob and Nash, about 3 to 5 days. So they recommend the SCI individual should perform 3 to 5 days at least for aerobic exercises, and WHO 75 to 300 minutes. And from Guinness et al. 2011, they recommend 2 days a week, and Tweedy et al. About 3 days a week. And then, however, they are very agree that the intensity should be moderate to vigorous from 12 to 15 rating perceived exertions or RPE. And then the time per session about 20 to 60 minutes. WHO does not recommend anything. Guinness et al. Recommend 20 minutes, and Tweedy et al. About 20 to 30 minutes. And actually, Guinness et al. And Tweedy et al. Have some argument. However, if we look into the aims of the rehabilitations, if we want to prevent from cardiovascular disease, longer accumulation time of exercise is needed. So therefore, we can go to 3D recommendations, which is at least 20 minutes, but you can accumulate the exercise until 30 minutes. Okay, so if we look here from the three authors, from the three scholars, they suggest at least 20 minutes, but not too long, until 60 minutes to avoid fatigue. And also 30 minutes is just okay, not too long, not too short. Okay. However, what is the method of training to increase the aerobic exercises? Either we just ask them to propel the wheelchair for 30 minutes, it must be boring, or Zumba 30 minutes, it's very difficult, they don't have the programs. So according to previous research, okay, circuit base is one of the exercises, one of the program that can give enjoyment, okay, to overcome boredom. Because circuit base, they are very, you can set so many exercises at one time at different stations, but we can modify their intensity by giving them interval trainings. Okay, this one, the interval training, we can start from moderate to high intensity. So circuit based and interval training, we can call them a circuit based interval training. So this CBIT is the combination of circuit and interval training, can start from moderate to high intensity. So this is the advantage I said just now. It can give enjoyment, overcome boredom, and also must be progressive in order to obtain physical fitness. And it's cheap because you can design anything. Depends on your resources, your clinical setting, and equipment. However, it's just we need the patient need efficacy and knowledge, so to perform by themselves at their homes, and also requires manpower because we need to monitor to change the station. So every sessions, how many minutes? So we need a record keeper for timekeeping, something like that. So, however, okay, as a starting, before we can recommend or briefly describe the exercise to them, we need to make them understand about the intensity. Okay, for able body, usually we wear the smartwatch, okay, to monitor the heart rate. But because of a spinal cord injury, the wearing of smart gear or smartwatch is still questionable because of the blunted heart rate. Okay, because most of them very difficult to achieve the desired heart rate. For example, maybe the target heart rate about 120, but because of the blunted heart rate, the maximum they can achieve about 110 or 100, something like that. So that's why, according to previous studies, we prefer both scales to monitor the intensity. So we have two kind of both scales here. So first one, the typical one from 6 to 20, okay, and second one is the modified RPE. But for the patients, I suggest for you to use modified RPE because it's very simple, 0 to 10. For let's say, after exercise, you may ask the patients, okay, what do you feel now? If you use this one, 6 to 20, they are very confusing, either 14 or 15. So because of too many numbers, they need to remember what they feel. But if you use modified RPE, 0 to 10, it's very simple, it's very short, and less confusing. So I would say from moderate to high intensity, we can start from 12 here. So the description is not the patient notice breathing deeper but still comfortable and conversation possible. Okay, and then progressive until 18. This is the maximum intensity of these trainings whereby the patient feel deep and forceful breathing, uncomfortable and don't want to talk. Okay, so you just ask the patient what they feel, what numbers. After they complete the exercises, they may give you the question. They may give you answer about 4, 5, or 3, or 6, or something. Okay, so before we begin the CBIT, circle-based interval training, you must ensure the exercise safety. Okay, make sure the patient do not have severe cardiac disease. Or pressure sore, severe pressure sore, frequent autonomic dysreflexia, spasm, and depression. Maybe because of the depression, they are reluctant to involve with the exercises, or they're just doing in the middle of the doing halfway. And then inform patient that they may withdraw from the exercises at any time, and they may wash the face or drink during rest. This is very important to avoid of occurrence of autonomic dysreflexia, or we call as sudden increase of blood pressure. Okay, and then please perform the general warm-up, including stretching and aerobic warm-up, and also for cooling down, and brief to the participants about the exercise, including the RPE feedbacks. And after finish the exercises, ask and check the patient for any injury after exercise completed. Okay, so this is the diagram for the exercises. Okay, so at first week, okay, we can start with level 1. Okay, you may start with 3 stations. So now we begin with level 1 of the exercises at week 1. The exercise consists of 3 stations, consists of wheelchair propellings, boxing in sittings, and arm cyclings. Okay, actually the exercises you can change and design by your own according to your resources, clinical settings, and whatever equipment available in your settings. And first, okay, the patients may perform the exercise according to the RPE 12 to 14, and then the exercise must perform about 3 to 0.5 minutes, 3 minit setengah, and then after complete this 3.5 minutes, the patient allowed to rest for 1 minute. So after finish these exercises, after finish the exercises, the patients can go to the next stations, and then they perform the boxing in sitting with the intensity of 12 to 14 for 3 to 0.5 minutes, and then rest for 1 minute. And then after finish, they can go to the next station to perform the arm cycling with the intensity of 12 to 14, and then for 3.5 minutes, and then rest for 1 minute. Actually, you can put 3 patients to perform the exercises simultaneously. So 1 patient here, 1 patient here, and 1 patient here. So first patient can start with chair propelling. After finish, the second patient can go to arm cyclings, and then the third patient can go to wheelchair propellings. So it can save your time. You can increase the physical fitness for 3 patients at the same time. Okay, and also from my experience, one of the way why they are very engaged with this exercise, because it can have like competitions feelings, you know. This kind of exercise, they have like competitions elements, because one patient will see the other patients, they try to compete each other. So they like, you know, they feel fun because they're doing the exercise with their friends. Okay, but they must perform 2 rounds to obtain 21 minutes on RPE. Okay, so the patient can progress to next level if there is no signs of overbearing fatigue or tremor, and also patient able to complete the exercise minute without stop in the middle of the exercises. So for level 2, we suggest you can apply this at week 2, in week 2 and week 3. Okay, still the same, wheelchair properly, both sit in sitting and arm cyclings, and they must perform the exercise with intensity 12 to 14. It's just the exercise time you increase to 4 minutes. Okay, and then you rest for 1 minute. And then after complete 4 minutes, they can go to another station to perform both sit in sittings. Okay, with same intensity, same time and same rest minutes, and then they go to arm cyclings to perform intensity 12 to 14, exercise time 4 minutes and rest time 4 minutes. They must perform 2 times to obtain 24 minutes on RPE. So they still can progress to next level if there is no signs of fatigue or tremor and able to complete the exercise minutes. So at level 3, okay, you can apply this at week 4 and week 5. Okay, so still perform the same wheelchair properly, both sit in sitting, arm cyclings. It's just you need to increase the RPE by 14 to 16. Okay, and that's the exercise time still the same, 4 minutes, and rest time 1 minute. Okay, after complete, they can go to both sit in sitting with same RPE, exercise time and rest time. And then after finish, they can go to arm cyclings with same RPE, exercise time and rest 1 minute. They must perform 2 times to obtain 24 minutes on RPE. So, and progress to next level if there is no sign of overbearing fatigue or tremor, and patient able to complete the exercise minutes. So at level 4, okay, you can apply at week 6 and 7, still the same exercises, wheelchair propelling, both in sitting, arm cyclings, and still same intensity. It's just you increase the time 4 to 0.5 minutes and rest time to reduce to 30 seconds. Okay, and then after complete, go to both in sitting with same intensity, time and rest time. And after finish, go to arm cycling with same RPE, same time and same rest time. So perform 2 rounds to obtain 27 minutes on RPE and progress to next level if no signs of overbearing fatigue or tremor, and patient able to complete the exercise minutes. Okay, the last level, okay, for my experience among all of my patients, only 1 or 2 of them can achieve this kind of level. This is very, very high intensity. Usually, most of them stop at level 3 or 4. Okay. Okay. So here, wheelchair propelling, still the same. The exercises, both sitting and arm cycling, is just for first 2 minutes. Okay. For first 2 minutes, the RPE. Okay, for first 2 minutes, so the first 1 minute, the RPE should be 14. Okay, and then another 1 minute is 18. And then without rest, for last 2 minutes, the RPE is 14. And then after that, the last 1 minute, the RPE should be 18. So that means it's like a wave. Like Dr. Aziz said just now, it's like a very short burst and very short rest. So in 4 minutes, okay, first minute is RPE 14, okay, and then they must increase their RPE into 18, and then for the last 2 minutes, Okay, they slow down, go back to 14, and then increase again into 18 RPE. Okay, so after complete the first 2 minutes and second 2 minutes, okay, they can rest about 1 minute. Okay, they can rest about 1 minute and go to next stations and go to next station after complete. So they must perform 2 rounds to obtain 27 minutes on RPE 40 until 14 and 18. Yes. Okay. Okay, so basically we have 5 levels, and then depends on the patient progressions. Okay, you may apply some of the levels, depends on the weeks of the exercises. Okay, so this is the exercise alternative for the CBIT. Okay, maybe wheelchair propelling, you need a very large space for them. Okay, but you can change with this kind of exercises, such as seated barbell shoulder press, seated dumbbell shoulder press, seated rear deltoid fly, seated dumbbell side lateral raise. It's just you need to careful with the weight you give to avoid resistant effects, because this is aerobics exercises, and also to prevent from leave fatigues, because we need them to engage with the exercise. We don't want them to stop in the middle of the halfway. Okay. So after they perform the exercises, maybe at the baseline before they start, or and after 4 weeks, and after 8 weeks, you can perform the exercises, because just now I said the exercises, they have 5 levels in 8 weeks. So before they start, you can perform the exercises, and after 4 weeks, you can perform again, you can test again, and lastly, at the week 8, you can apply again this test to check their fitness levels. So for people with disability, mostly, most of them using wheelchair. So for able body, maybe we use a 6-minute walk test. But for wheelchair, we use 6-minute wheelchair push test. Okay, so how to conduct the exercises? Okay, this one requires space. You need to find the space, and then it's a 30-meter loop course. This is the 30-meter loop course. Okay, marked by 2 cones, spaced 15 meters apart with 2.8 meters on either end to allow for turning. So it's separated by 15 meters by 2 cones. Okay, and then with 2.8 meters on either end here to allow for turning. Okay, to allow for turning. Okay, this is very important. Otherwise, the wheelchair unable to turn. So you need to give some space for them to turn. Okay, all right. So the distance from the cone is about 2.8 meter. And then subjects were allowed to practice for 2 minutes. Wait, 2 minutes before the actual test begins. Okay, and then the distance traveled in 6 minutes was computed by multiplying the number of complete laps by 15 and adding the distance traveled in the last lap. So the distance traveled in 6 minutes. So you must take the time about 6 minutes and how many meters they perform the test. Okay, they obtain the distance. So the farthest they go, okay, the good their fitness level. So for let's say the distance traveled in 6 minutes was computed by multiplying the number of complete laps. So from here until here is first is a 1 lap. Okay, 1 lap. Okay, let's say the patient start from here. Okay, and then go, and then the propel, and then until here is the 1 lap, and then from here until here is 2 lap, and then from here to here 3 lap, from here to here is 4 lap. For let's say 4 laps times to 15, so the patient obtains 60 meter. Okay, but for the turning space is not included in the calculation because we only want to have straight results. Okay, and then okay, let's say if the patient propel until here, until here, until here, until here, and four laps, and then suddenly stop here because of the fatigue. Okay, and then you just add on about 7.5 meter with the 60 meter just now. Okay, so the patient obtained 67.5 meters. Okay, and then you can compare with the results currently for Western population about 600 somethings. Okay, but for Asians, most of them is about 280 meter. Okay, and then if your patient got more than this kind of distance, that means your patient is quite good in their fitness. And then for functionals, speeds is about 360 meter. Okay, so the result of your patient you can compare with this kind of baseline. Okay, this is the testimony. This is my patients who went for these programs. Saiful and Logendran previously is very sedentary, but when they went for the fitness program, they now become active and strong. So they went for Paralympic selections and now selected as Negeri Sembilan athletes. And this is the Run and Roll program by Hospital UKM. If I'm not mistaken, in 2019, only one program for disabled people, okay, for Run and Roll. But I don't know, it's very discriminated because they just allow for fun run for about 3 meter. Okay, 3 meter is very short. Okay. Maybe in the next, if we can conduct some programs, we need to give like 10 meter rolls for them, maybe. Okay. And next, this is Encik Aziz. My patients also, after they went to the programs, they're going back to their homes and they teach the others people in their communities. So they go for hiking, they go for sports and recreations in park, you know. Okay, so this is some the videos. This is the videos, this is the program, Parafit, or I call it as a Parafit programs in rep centers. Consists of progressive strength trainings. This is where I said the wheelchair, you know, wheelchair exercise machine for strengthening. You can use if you want.
Inilah untuk program fitness yang membantu saya untuk meningkatkan aktiviti kebiasaan saya dan juga untuk aktiviti patient education tu banyak ilmu saya dapat untuk digunakan bila saya keluar nanti untuk meneruskan kecergasan saya lah.
You may support a bit if they have instability of the trunk.
Dulu saya menolak wheelchair begitu perlahan. Selepas saya join
you can see before this patients in stable,
ilmu untuk berkali
but they need fitness, return to preparations. And this is the stick spinning, which I push test that I also using as exercise stations, progressive training. This is the wheelchair sitting. As I said just now, we need some manpower. And this is the arm cycling.
Bagi saya, program fitness ini dapat memudahkan kerja saya dalam meningkatkan kecergasan pesakit dalam masa yang sangat singkat. Selain itu, program education yang telah direka juga dapat memudahkan saya dalam memberikan
system so that they can bring the knowledge at their home to replicate the exercises at their home.
Ini ada ada sensori, ada motor, tapi tak kuat S.
So the protocol of exercises you can search. Is already published. You can search in Google Scholars. Okay, next. Okay, if for further update or for more videos, you can search my my channels on YouTube. You can just search Parafit Hafifi. There's a lot of videos here. Most of them are chronic SCIs. You can see they perform the exercise without supervisions after we giving the knowledge to them. Okay, so there's a lot of videos you can search here. And then because of the COVID pandemics, I decided to do some tele-rehab for them. And then it's a very show very good results to them. You can also see the videos in my channels. And then this is the studies, the protocols have been published. You can search in Google Scholars using these references. And okay, this is a gold medals award and best presentations poster. And okay, with that, that's my conclusions. The physical fitness is important for enhancement of functions and complication preventions. And the CBIT, circuit-based interval training, may useful, okay, as a shortcut. Okay, it's a shortcut. Okay, but for maintenance, they must engage with physical fitness program, including sports, recreations in their place. Okay. Okay, with that, thank you. That's all.
Okay, thank you, Mr. Hafifi, for your impressive presentation. Thank you. Thank you.
Okay, thank you very much.
Okay, I would like to remind all to fill in the attendance form in the chat box. Okay, fill in your attendance in the chat box. Right. Now we move to Q&A session. Right. In the chat box, there is no question. I will allow question, or you have a verbal question, you can ask Mr. Hafifi now.
Okay.
If you don't want to ask verbally, you can write in the chat box. It's okay.
Sorry, Cik Hafifi.
Yes.
Okay.
Yeah, I'm Sherina from Gleneagles.
Okay, sure.
Boleh saya tahu
Nice to
just can indicate 5 indication for you to put in the CBIT program? Is there any level involvement and how chronic that the minimal level of chronic that you join in the program?
Okay. Usually, okay, this one, first criteria is they must medically stable. Okay. And then without any severe complications such as pressure sore. Okay, to avoid, because we're afraid of they sit for too long for the exercises, and because of the sweat, it can cause the skin to wet and cause and make it the pressure sore become worse. And the second one, severe spasm, because when they perform the CBIT, suddenly there's spasm, so they must stop the exercises. So and then second one, the patients who have low physical fitness, so you may assess first the fitness level by using the 6-minute wheelchair push test. If they are below the baselines, so that means they require these exercises. And then the third one is patients who wants to get active, okay, to return to communities and return to works, because when they go to work, they definitely need sufficient physical fitness, for to propel the wheelchair, for transfers, to drive cars, So actually, people with spinal cord injury, they must perform the transfer about 20 times a day. Okay, started from wake up from sleep until they go in sleep again. If we can count, they must perform about 20 times of transfer, okay, a day. So they need sufficient physical fitness. And then the fourth one, the patient who have boredom. For example, they are frustrated or it's not frustrated, they are boring with kind of current exercises, maybe they want something fun, they want to have exercise to perform with their friends. Okay, and then fifth one, maybe someone that they want something high intensity to challenge the physical fitness. Yes, something like that. I hope I can answer your questions.
Thank you.
Okay, thank you.
Okay, I will take a second question from the chat box. Wait. This from Mira, if I'm not mistaken. Oh, where's Mira question? Okay. Another question from Mira Faisal. CIBT can be used for all ages? This is the question.
Yes, definitely. Um, yes, I understand. It may be high intensity or maybe not suitable for geriatric, but I think if for geriatrics or elderly or older SCI individual, they can perform, they can use the CBIT. It's just maybe they may reach 1 or 2 levels, but you don't force them. It's just it's just the important thing that can achieve what they can. All right, and then please frequently test their performances. If their performances can can meet with the baseline, it's enough for them. Okay, depends on the goals of repetitions. Back to basics. So I would say the exercises is suitable for any age. Yes.
Okay, Mustafi, our next question in the chat box
Yes.
from Emmeline Samsul. I think you quite familiar this name. Is there any shoulder care after patient do the upper limb exercise?
Shoulder care or what? Shoulder care. Okay. Yes, as I said just now, the exercise instructions. So maybe after the exercises, you must ask the patients if there are any injuries or pain after doing the exercises. Okay. For the shoulder care, maybe we can ready with ice, maybe because if they get pain, we can just provide them with ice, and we need to monitor their injury frequently. Yes, actually, after exercises, for shoulder care, we can provide them with conservative treatment, like a usual care that we provide to a patient with pains. Yes, and I think because from my experience, patients who went for the strengthening exercises, uh, they may complain less because the strength they gains, but we can always be prepared with the pain management or pain injury preventions and or pain injury equipments after the exercises. Okay.
Is that answer your question? All right. Now, perhaps this is our last question, perhaps. Okay. Mr. Hafifi from Ms.
Okay.
Mira also. From the functional measurement of SCI patient, what
Yes.
are the minimal functional limit that the patient able to continue with CIBT?
Minimal functional limit. Can you explain more about minimal functional limit? I I really don't get it. Minimal functional limit.
Maybe Mira Faisal can clear it, the question verbally.
Hello, Mr. Hafifi. Sorry, my camera is not working right now, so I cannot open the camera. So I'm Amira from UiTM. So what my question is, how about macam mana dia punya functional limitation that can affect the punya CIBT training? Is it the patient need to achieve some of the functional measurement before they can?
Oh, okay. I understand. Okay, this is very good questions. Okay, usually most of them are chronics. Okay, you just need to assess their first is their fitness level. Okay, and the second one is the wheelchair skills. Okay, because most of them, even they are chronic, they are not propel the wheelchair in the right way. Okay, you can search more on in the evidence how to actually propel the wheelchair in the right way. Actually, we have two phases of wheelchair propelling. First is the propel, and second one is the rest periods. So most of them perform the wheelchair propulsion with high repetitive with no rest. So it can cause what we call shoulder pains. Okay, you just need to ensure they propel the wheelchair properly, so to avoid from shoulder pain, and yeah, that's the most important thing. Okay.
Okay, Mr.